Type 2 diabetes and exercise. Every cell in the body needs glucose for energy. Glucose gets into these cells by the hormone called insulin. Type 2 diabetes is a condition where this insulin doesn't work properly. Think of a lock and key analogy. When we eat something containing carbohydrates, glucose gets released into the bloodstream. From here, it travels around to where it needs to go, and our pancreas increases production of insulin. This insulin acts as the lock to let glucose into the cells. In type 2 diabetes, glucose, or the key, doesn't quite fit into the lock. This is known as insulin resistance, and the blood glucose stays floating around in the bloodstream. The raised blood glucose can then lead to complications. The good news is, there are a number of ways that exercise can help to manage type 2 diabetes. Here are the 4 ways that exercise can help. Number 1. When you exercise, you use glucose as energy. Number 2. If you have a small muscle, there are less means of access for glucose to get in. When you build muscle, they increase in size and therefore have more means of access. Number 3. When you exercise, a transporter comes up to the surface and lets glucose into the muscle cell without insulin. These transporters can continue to do their job for up to 48 hours after exercise. These 3 ways help to take glucose out of your bloodstream and use it up. The 4th way impacts insulin directly. Number 4. Exercise helps your body's insulin to work better. As a bonus, exercise also helps to control your hunger hormone, which assists with weight management. Doing regular aerobic and resistance training encourages your body to make these adaptations. Just 2 effective exercise sessions a week is enough to start getting these great benefits. If you want to get started on your journey to better health, follow these links for further information.